Support for WPR comes from Schultz Nonprofit Law, sharing WPR's mission to inform and inspire, and providing advice for nonprofits, cooperatives, and other social enterprises. SchultzNonprofitLaw.com.
Support for WPR comes from Viterbo University, offering online bachelor completion programs, including business, education, nursing, and more. Information is available at viterbo.edu/completion.
Thanks for joining us today on WPR News. Larry Mealer here. We're talking your pet's health today with Dr. Bill Stork back on the show. He is the owner of Lake Mills Veterinary Clinic. He's authored several books, and always great to have him stop by to share a few things you can do this spring to make sure your pet is healthy. And as we talk with him, we want to hear from you, of course. Tell us how you're taking care of your pet this spring, or maybe let Dr. Stork help you out with your pet health questions. Number to call is 800-642-1234, or you could send an email to talk@wpr.org. Dr. Bill Stork, welcome back. Good to have you with us.
Well, good morning, Larry. Glad to be here.
I want to turn our attention to bird flu for just a minute to begin. It's been in the news a lot. How big a risk is bird flu to your dog or cat?
Sure, it's pretty real. And so far, we haven't found a lot of impact in the canine population. But with regard to cats, there have been a few cases, not locally. We haven't heard of any. But in other states, it certainly has been an issue. And primarily among cats that spend time outdoors, primarily among cats that might make a meal on a bird that has been affected by bird flu. And the other avenue by which cats can be exposed to bird flu is by feeding raw meat, raw diets that have been infected with the bird flu. Now, although we have quite a few of our dogs that are fed raw, I don't know of very many, at least in our practice, of our clients who feed their cats raw food, but there would be a precaution as well. And the bird flu can be pretty pathogenic in cats. They can be pretty profoundly affected. So it is to be taken seriously if suspected.
Yeah, are there symptoms that are expressed among cats?
Respiratory and neurologic. When it gets really, really bad, they can be neurologic, and respiratory symptoms can be associated with the bird flu. And, the enormous majority of the cats that we see in our practice are from shelters, are strays, are from rescues, in which case it's more noteworthy when we find a cat that hasn't been affected with something respiratory, runny nose, goopy eyes, things like that. But when those cats are profoundly sick, lethargic, running fevers, not eating, those are going to be the signs that throw us into gear and employ the good folks over at the Wisconsin Veterinary Diagnostic Lab.
Yeah. A lot of people are doing some spring cleaning at this time of the year. This morning I took a look at my cat plates and these need a little cleaning. I hadn't done it for a few days. I mean, we ought to be cleaning those water bowls and those feeding trays or whatever.
Yeah, water bowls and water dishes, that's a real deal. And we encourage people to use either glass or stainless steel or pottery can work out really well as well, not to mention the fact that it's pretty stylish and available by a lot of local potters. But a thing that has been mentioned recently is stainless steel litter pans. And when I first heard about that, I thought, why on God's green earth would I pay all that money for a stainless steel litter pan? And the answer to the question is we discourage people from using anything that resembles a detergent when they clean out the litter pans because we don't want foreign odors in that litter pan. And the plastic starts to take on the character of the litter and all of the waste that has been through the litter pan. So the stainless steel by name, when you wash it, it's gone. And a lot of people who have cats known for violating the litter box, for going outside the litter box, find that an impervious stainless steel litter box has been a great solution for them.
Hmm. Any house, well, you mentioned cleaning and household cleaning products. Are there some you should definitely avoid because they're maybe toxic to your pet?
They may be toxic and they may be odors, and especially with cats, we're better to just use water and scrub them out and avoid anything that could be a toxin.
Mary Lou has a question about cats. Let's turn there. Mary Lou in Monroe, thank you for calling.
Yes, good morning. I have a almost 6-year-old female golden retriever, and a week ago she developed a bladder infection, and we treated it with amoxicillin, and she's all fine and everything. My question is, why did she get it? I've never seen a bladder infection in dogs before, and what can I do to prevent any future bladder infections?
So the perfect question, and urinary tract infections are pretty common in dogs. And the answer to the question is multifactorial, because we think of the bladder as should be pretty inert, fills up with urine, empties with urine. But that it doesn't always work that way, and there can be some intricacies in their anatomy that allow urine to leak back through the urethra into the bladder, so that urine almost makes it out, and then it leaks back into the bladder. Sometimes when they don't have access to outside as frequently, that can contribute. And then there can be some external anatomic intricacies that can lead to, then can make your dog a little bit more prone to urinary tract infections. If their anatomy is infolding and they are allowed to pool urine around their external genitalia, those are the kind of things that can make them a little bit more prone to urinary tract infections. So hygiene, making sure that they are clean back there, can be a big deal. Ensuring that they get out as frequently as they need to be out, making sure that they're out long enough to completely void, to completely express. And on the front end, the more water they intake, the more urine they put out, the more dilute the urine that they put out, and the less prone they are going to be to urinary tract infection. So multiple water dishes, as Larry was talking about, spotlessly clean water dishes can make a difference. Your dog will drink more water if it has 2 dishes than if it has 1 dish.
Oh, there you go, Mary Lou. Thank you for calling. Wanted to hit on flea and tick prevention for a minute, perhaps, Dr. Bill. Maybe first explain how ticks spread Lyme disease to pets.
Really good point that we could spend a great deal of time on. And my dad used to always say, son, be careful, because after a while you start to believe your own BS. And for a very long time, I went around spouting the statistic that 25% of the ticks in our environment are Lyme positive. Well, don't look now, but I circled back and I went to a continuing education meeting very recently, and it's true. Here in Wisconsin, in the Midwest, half of our ticks are deer ticks and half of the deer ticks are Lyme positive. And so very much worth being aware of. And for example, my daughter, who went to school at the University of Vermont, Lyme Central, all of a sudden developed a real phobia of ticks and Lyme disease. And when she comes out to our place in the country, she wants to walk in the middle of the field. And I asked her, Paige, where do you walk your dog in Madison? Well, I walk him in the sidewalk. And for example, in Larry's neighborhood, There are a number of people who choose not to mow their grass, and instead they plant wildflowers in raised gardens on the margins of the sidewalks, which could not be a more perfect environment for ticks. Because ticks, they are attracted to carbon monoxide, motion, and heat, and they are the most opportunistic little varmints you've ever found, because they will flag. They will exist in greater concentration on the margins of the sidewalk, the walking paths, the bike trails, things like that. So when a warm-blooded blood meal comes by in the form of your dog or us, they're ready and waiting. And so, the way to answer the question, the way ticks transmit Lyme disease, they take a blood meal off of a Lyme positive animal, oftentimes a deer or other wild animals or other dogs, and then they pass it on to a previously uninfected animal. And we're a little bit fortunate in dogs, because in dogs there seems to be a longer incubation period. After your dog has been infected by Lyme disease, there seems to be a longer incubation period. So we have longer to detect that infection than we do in people. In people, and I'm careful not to dabble in human medicine, it seems to be a much shorter incubation period after we've been exposed. So, worthy of caution, folks will ask us frequently, man, I'm not sure that I want to put those chemicals either on or in my pet. And my answer is totally agreed. We're always weighing risks versus benefits. But when Lyme disease goes really well in your pet, it causes anemia, platelet deficiency, fever, lameness. 10% of the time when your dog becomes Lyme positive, when your dog develops Lyme disease, it affects their kidneys. And that can be, and oftentimes is, fatal. So, those products are pretty well researched, and oftentimes people will want to use things that are more natural. I completely and totally understand those things, citronella, garlic, things like that. But in my experience, limited as it may be, they just don't seem to cut it when you are truly exposing your animals to ticks. And if you are taking your dog outside in the state of Wisconsin or the upper Midwest, you are exposing them to ticks.
How many tick and flea cases do you typically see, or have you seen perhaps in the last year in your clinic?
Last year was big time. So, old guy here, if this were TV, folks could see that I'm 60 years old. I've been at it for a few minutes. When we first started testing for Lyme disease, it was not in the least bit unusual for us to find 250 to 300 Lyme positive dogs a year. And a lot of them were clinically affected by Lyme disease. Along came the waves of prevention that we have available to us now, and we've seen the number of positive animals diminish over the years. We've seen the number of clinically ill animals diminish over the years, and now our practice is considerably larger than it ever has been. Last year, we found in the vicinity of 125 Lyme positive dogs in our practice alone, but that was reflective of the winter of 23-24, in which case on February 24th last year, it was 71 degrees. Yeah. We started finding ticks on dogs in February of 24, and as a result, last year we saw a lot of Lyme positive dogs.
Dr. Bill Stork, our guest today, owner and operator of Lake Mills Veterinary Clinic. Questions for him? Give a call at 800-642-1234. Email to talk@wpr.org. I'm Larry Mueller for WPR News. After 12:30 today, we'll check in with the Wisconsin Humane Society to talk about how to adopt a shelter animal, among other things. Right now, we're taking a look at your pet's health with Dr. Bill Stork of the Lake Mills Veterinary Clinic. And Matthew in Iron River, Michigan, has a question. Let's go there. Hi, Matthew.
Hi. My dog is a little over 8 years old, and she doesn't eat as much as she used to or drink as much water as she used to. And I wonder if that's normal for that age or if it was something I should be worried about.
Yeah, what kind of dog do you have?
She's half pit bull and half coyote.
Oh, okay.
And Matthew, has she been checked out recently? Has she been to the veterinarian recently? And is she losing weight?
She doesn't seem to be losing weight. The last time I had her at the vet was a couple of years ago. It turned out she had Lyme disease, which I know is something you're just talking about. But they gave her antibiotics and anti-inflammatory, and she got better and seemed to be. I mean, she seems healthy and happy, and she doesn't eat that much anymore. I was just wondering if I should be concerned about that.
So I would be concerned about it. And if in doubt, we put some numbers on it. And, I would make an appointment and take her to the veterinarian and get a weight on her to see if indeed she has been losing some weight. And if that dog were in my practice, we would start with doing some blood work to make sure complete blood count, liver values, kidney values were all in line, because you bet older dogs, older people have a tendency to eat a little bit less, but I'm more comfortable with that once we know that everything is working properly.
Yeah, makes sense. Matthew, thank you for calling. Lucas in central Wisconsin, your turn. Hi, Lucas.
Hey, Mr. Larry, thanks for taking my call. My question is, are there any risks at all of eating wild game that would have ticks on them? A.k.a. bear, deer, whatever kind of wild game. Is there any chance of being transferred to humans if you're eating that game?
Yeah.
If we're talking specifically with regard to Lyme disease, then no, because in order to be transmitted, that tick has to bite you and take a blood meal from you rather than you biting it and you making them a meal. There are, of course, other risks that I'm sure that you're aware of with regard to eating live game, but no, we're not going to see Lyme disease transmitted in that fashion. Interesting question. Thank you.
Yeah, thanks, Lucas. Appreciate it. Jared in Stoughton, your turn. Hi, Jared. I'm sorry.
Hi.
Yeah, well, there. We've got you. Thanks.
All right. Thank you. I'm glad to be here. I have a 4-year-old standard poodle, female. She's well taken care of, regular vet checkups, grooming, all that stuff. But she has battled most of her life now with discharge from her lady parts. We've had her in the vet here just a few months ago, and they round of antibiotics. It didn't really seem to clear it up. Here just recently, it's kind of turned a yellowish color, which concerns me. And I'm wondering if our vet is missing something and what we could do.
And Jared, is your dog spayed?
She is, yes.
Okay. So your veterinarian is probably not missing anything. And every now and then we run across one of those situations that can be a little bit chronic. And kind of circling back to the question that Mary Lou asked previously, and that can be external as a result of the configuration of their external genitalia. It can also be internal, because when we spay them, depending on the exact procedure which takes place, there can be a uterine stump that is still left. And in a very few dogs, when they are spayed, they will actually leave a little bit of the uterus itself. And there are some intricacies having to do with anatomy externally, anatomy internally. And in order to get through those things, sometimes we have to do cultures of urine cultures. Sometimes we have to do cultures of the discharge externally. Sometimes we have to have them on antibiotics for prolonged periods of time. And in rare cases, we have to do a little cosmetic surgery on them to relieve that situation with regard to the external genitalia.
So there's the options for you, Jared. Thank you so much for calling. Appreciate it. Lorraine in Washburn will go to you. Hi, Lorraine.
Hi. Thanks for taking my call. I have a question about, we had an article in our local newspaper about a new tick virus called Powassan, which is supposed to be very potent and serious for people. And my dogs, I have 2 corgis, and we have 5 acres, and they bring in ticks. And so I'm wondering if they can get this virus themselves, and does the NexGard Plus work against that type of virus in the ticks?
Well, I will answer the one part of that question I know the answer to, and that is yes, the NexGard should be effective. And Lee and I were talking about this. The producer, Lee Rayburn, was talking about this before the show, in which case people aren't allowed to call and ask questions that I don't know the answer to. So I'm going to have to research that myself because I can't answer that question accurately until I learn about that virus myself.
Okay, Lorraine, thanks for calling. Katie in Port Washington, your turn. Hi, Katie.
Hi, thank you for taking my call. I am calling about, we have 2 male cats, and they're about 3 years old. Since we've had them, I've had multiple people tell us that we need to feed them a mix of dry and wet food because male cats are at risk of getting, I think, kidney stones or crystals. So we right now just feed them dry food. Is that true that male cats need a specific type of diet to stay healthy?
Do they need a specific type of diet, Katie? Most of them do not, but male cats are certainly more likely to be at risk to develop what they're referring to as crystals in their urine. And if they form crystals in their urine, then those crystals can aggregate to form bladder stones, and they can become that classic obstructed cat. So things that you can do to prevent that would be meticulous litter box maintenance, multiple litter boxes that are cleaned all the time. Larry and I were talking about stainless steel litter boxes can make a difference. Multiple water sources, so they intake more water, can make a big difference. And the whole purpose of the canned food in their diet is to incorporate yet more moisture in their diet, which will produce more urine, dilute their urine, and make the crystals less likely to form. Here again, there have been cats for eons that have done just fine on straight up kibble. If you want to almost completely and totally eliminate that problem, there is a prescription. There are 3 prescription diets out there. One is urinary SO by Royal Canin. The other one is CD by Hills, that are dissolution diets. They're specifically formed to, specifically made to prevent the formation of crystals and stones in their urine. You're 3 years old, you haven't had any problems so far. That's a good sign, but they're never immune, and it can be a real deal.
Yep, I had that with Coco, one of my cats, and it was turned into a very expensive process to deal with that situation. So
yeah, and the food is not inexpensive by any stretch of the imagination, but you can buy a lot of bags of food for what that visit to the veterinarian cost.
Yeah, that's for sure. Katie, there you go. Thank you for calling. Nikki in Platteville, on to you now. Hi, Nikki.
Hi there. I have a cat that pees outside the box, and when she does this, she's been giving a convenience shot from the vet, and this takes care of her for say 3 to 4 months. But this month she got her convenience shot on Thursday, April 10th, and since then she's still peed outside the box 5 times.
Oh boy.
And I don't know why.
Well, and that one's a little bit hard for us to diagnose by way of remote control, but I can at least speak to some of the things that can contribute to inappropriate urination in cats. And I would say you're fortunate in that previously a shot of Convenia, which is an antibiotic that your veterinarian gave, presuming that there was a urinary tract infection, and that was contributing to inappropriate urination. Yay, we're always grateful when simple fixes work, but a number of things can happen from there. Your cat could have experienced discomfort in the litter box and therefore developed an association between the litter box and discomfort, and as a result is going outside of the litter box. And here again, painting with a broad brush, but some of the things that we associate with inappropriate urination are the substrate of the litter. We want to make sure that it is unscented litter that is kept spotlessly clean, changed very frequently. Cats are known for preferring uncovered litter boxes instead of covered litter boxes. When you clean them, when you scrub them, no detergents, disinfection, bleach, anything that's got anything that resembles odor in it, and location. You know, if the litter boxes, we want it to be really, really accessible. If perchance you have an older cat and the litter box is down in the basement, you know, that's a pretty good haul for an older cat. So we want that litter box to be really accessible. We've known older cats that have tall litter boxes that can be more difficult for them to get into. So it can be it always is a problem with multiple variables, and those are some of the things that can help.
Nikki, thank you for calling. Let's turn to Barb in La Crosse. Barb, hello.
Hi, thank you for taking the call. I have a 3-year-old beagle that we have regular vet checks, and I'm very happy with my vet, but I wanted to learn a little more about anal glands. She frequently has a fishy odor from that area, and she doesn't scoot her butt or bother at it at all, but it is a smell that can get on your clothes or your couch and such. And I've heard too many expressions over time is bad. Can you talk about anal glands, please?
The best that I've ever heard that odor described, and I wish I could take claim to this, was it smells like tuna in a copper bowl. And I can speak to that because this is a conversation that we have fairly frequently. And a answer that I will have for it is that if you're smelling it on your clothes, if you're smelling it on your couch, if you're smelling it in the bed, in your dog's bed, then that means it's no longer in the anal glands. And anal glands are a problem when they fill up and they don't empty out. And in a perfect world, what we would really prefer would be that when your dog defecates or when your dog chases, it's a beagle, so it's going to chase rabbits and squirrels and chipmunks. When it takes off after rabbits, squirrels, and chipmunks, or when it defecates, that's when they empty out. But in a crazy sense, your dog's anal glands are okay. They're emptying out. It's just in areas that are just not opportune when it comes to house cleaning and laundry. In which case, what we can do sometimes is be proactive, and we can empty those anal glands out manually so that they don't empty out when we want them not to. And man, I never believed these things could be effective, but according to our clients, there are supplements out there. There are treats out there with clever names like Glandex that are said to be quite effective, and adding fiber to your dog's diet in order to bulk up their stool can also help.
Barb, there you go. Thank you for calling. And let's turn to Josh in Eau Claire. Hi, Josh.
Hello, thank you for the program. I've got a 3.5-year-old super mutt that we got from a rescue. Got him about 6 months old, and he had a really severe case of what was diagnosed as Demodex bites. Since then, every once in a while, treat him with chlorhexidine shampoo, and it really hasn't been a problem since those first couple of months that we had him. But that chlorhexidine shampoo really seems to irritate his skin. So I was wondering if your guest maybe had a different recommendation, or maybe I should just forget about the Demodex entirely.
Well, what I will say is that if a chlorhexidine bath every now and then was helping the skin out, except for it was drying the skin out, you're probably not still dealing with Demodex. Because if you were dealing with Demodex, if it were one of those few dogs that have chronic Demodex infections, you would know it, because Demodex is a beast. And when it turns clinical, it can cause dogs to lick the fur off their paws. They have really nasty red lesions, hairless areas, skin infections, things like that. So you're probably not dealing with clinical Demodex anymore, or it would take something much bigger than the chlorhexidine to solve it, in which case you're free to use whatever oatmeal shampoo that seems to do your dog's skin any better. And just an interesting side note, what veterinarians do with their free time. We went to a continuing education meeting once upon a time, and there were a dozen or so of us in the room, and we did skin scrapings on ourselves looking for Demodex. And the statistics held up fairly well. Dogs, cats, people, there's a solid 20% of us who are infested with Demodex at a very low subclinical level. But as was the case with your dog, they were overwhelmed. So you're probably fine at this point in time with regard to the Demodex.
Josh, thank you for calling. You can join in too. Number to call 800-642-1234. Email to talk@wpr.org. Carol emailed and wonders what contributes to diabetes in dogs. Can things they eat contribute to it?
Diabetes is one of those multifactorial conditions, and there are a few things that you can do to make diabetes less likely to happen, much like people. Keeping them active, keeping that at an appropriate body weight can make a big difference. Excessive body weight is probably one of the biggest contributors to diabetes in dogs and cats. Beyond that, the things that can contribute to diabetes is not so much things that you can or cannot feed, but how much of it that you can and cannot feed. Meals that are excessively fatty, meals off the table, leftovers, meals out of the refrigerator, can contribute to dogs developing diabetes. So keep them at a good weight and avoid excess fat.
Aaron in Westby emailed, Aaron brought home a new dog last weekend. She came from a loving home who just couldn't keep her. However, she does not seem to want to drink, especially from a gravity-fed water bowl, and doesn't want to go to the bathroom outside. She just hugs Aaron's legs. Any tips on how to get her to use the bathroom outside? She's also afraid of her yard leash, which she needs to be on until trained on their underground fence. So they just brought her home last weekend.
Boy, it sounds as if you've got a poor kid there, Aaron, that has not been socialized very well. And with regard to the water consumption, we don't know how big the dog is, but if the dog is eating, then it's probably drinking enough to keep up with its requirements in that regard. And with regard to a dog that is so bonded to you, man, I would recommend you find yourself a Mitzi Voiles. And Mitzi Voiles is our neighborhood behaviorist. And you're going to need a behaviorist to come to your home to be able to dissect that situation. And I would beg you at this point in time to not even think about using that invisible fence until you have this dog dramatically more comfortable being away from you, because separation stress, separation anxiety is what you're describing. And those things can be among the most challenging behavioral issues we encounter in all of veterinary medicine. So, loving family, there's hope, but it's going to take a lot of work and a lot of time.
And I would think it hasn't even been a week that the dog.
There are some things that very much hold up. And some of the things that hold up, we say 3 days, 3 months, and 3 days, 3 weeks, and 3 months. And in those increments, you will notice changes in that dog's personality. And basically the things that you have to keep in mind are that, the behavior that you reinforce, you will see more and more of that behavior. So you want to be really careful with how you respond to how this dog is reacting to you. So,
okay,
good luck. That one's going to be tough, and it's going to require some boots on the ground expertise.
Carol in Madison, your turn now. Hi, Carol.
Oh, hi. Yeah, thanks for taking my call. Hey, I've got a female tabby, and and you can hear her in the background. She's gotten very vocal, and she has lost weight. Now, all of her eating habits, everything is exactly the same. Her activity, she loves the mouse on a stick, and she's wonderful, but there's just been this weight loss, and I'm concerned about it.
Carol and Madison, how old is your tabby?
Well, it's kind of questionable. When I adopted the cat in 2018, and they said she was 11 at that time, and now it's how many years later? 7 years later, so 18 maybe?
Okay. My first, second, and third suspicion is that your cat is hyperthyroid. When you describe a cat that is eating well and energetic, active, vocal, but losing weight, I'm suspicious of a hyperactive thyroid in that cat. So I would get to your veterinarian and don't tell him the guy on the radio says my cat's hyperthyroid. Just tell him what's going on, but I bet you they're going to recommend blood work.
Yeah. Carol, good luck, and thank you for calling. Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic, our guest today. I'm Larry Mealer for WPR News. We're taking a look at your pet's health today with Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic. Great to have Dr. Bill back. And we'll turn back to the phones and to Mike in Stevens Point next. Mike, thank you for calling. What's on your mind?
Thanks, Larry. Thanks, Bill. Yeah, I've got a 5-year-old Australian Shepherd, great dog, but she is super anxious around storms or really any kind of rain, and she'll get pretty bad, an hour or so before the rain starts, and will stay that way through the storm. And she almost looks like she's in physical pain throughout the entire process. And we've talked to the vet, and they've given us medications to give her, a few hours before the storm. That tends to help a little bit, but she's still, really unreconcilable through that entire process. Can't get her to move to certain areas, have to carry her, just looks in physical pain. Any other recommendations?
Is there anywhere in the house that she will go, like downstairs in the basement, in her kennel, behind the toilet, in the bathtub? Is there any place that she will go and be more comfortable there?
There are some places where she'll be slightly more comfortable. The shower, in particular, she'll walk-in showers. She'll lay down on the tile there, in the basement or in the master bedroom, and she's slightly more comfortable. But she's still, if you go to her, she still looks like she's in pain. She'll be shaking, drooling uncontrollably, and so even there, I think she's slightly more comfortable, but still struggling.
Okay. Yeah, sounds like she's a pretty hardcore case, and I feel badly for the poor kid. When I was young, we had a collie we knew that there was going to be a storm 2 hours ahead of time, and that dog would jump in the back of my dad's pickup truck and curl up and go to sleep, and everything was just fine. But unfortunately, your Aussie is beyond that. So we've had people who have gone all in, and they've had dogs that are to that effect. And essentially, they build the poor dogs like a bomb shelter in the basement, literally an insulated hutch kennel that is padded, and it is dark, and it is surrounded by insulation. Other things that can be beneficial are to have like other ambient noises. I'm pretty confident that these guys are able to detect the difference in pressure, and that's what has a tendency to set them off. And they're way more accurate than Google Earth maps than at predicting storms coming. And with regard, your veterinarian probably tried trazodone. You may ask him, is there some room to increase the dosage of trazodone? If the earlier you can get those drugs on board, the more effective they are going to be. Sometimes we'll try a couple of different medications. We'll try like trazodone and gabapentin at the same time. Can help with these guys. So a shelter in the basement, dark, ambient music, and just ask your veterinarian if there's any wiggle room with regard to the doses. And obviously, the earlier that you can get them on the board, the more effective they'll be.
Yeah. Way earlier, do you mean like 4 hours before a storm, or?
Yeah, in an ideal world. And then every now and then, they will predict that a big nasty's coming from the west, and we know ahead of time that it's coming. And a 5-year-old Aussie, whatever your activity is, walking them, playing ball, playing frisbee, going for a bike ride, going sniffing, doing anything and everything you can do to take as much mental and physical energy off them as the storm approaches. And I know that's a big ask. We don't always know that they're coming with accuracy, but just kind of trying to get inside your situation and help as best we can, Mike.
Mike, there you go. Thank you very much for calling. And on to Sandra in Nakusa. Hi, Sandra.
Hi, thank you for taking my call. I have a couple of little dogs, Yorkie mixes, and I took them off of canned dog food, wet dog food, because they were having some little stomach issues. And I've been making their own homemade dog food. I use ground turkey, brown rice, a few eggs, some vegetables such as carrots, and a variety of different things. And I was told that I need to add some vitamin in there. Is that necessary to add powdered vitamins? What do you think?
Well, what I think is that when people choose to cook for their pets, I think that's a great idea. But you're starting off strong with regard to the turkey and the vegetables, and you've got most of it going there. I would direct you to a website, and that website is called Balance It. And Balance It is really simple, really straightforward, And you just tell them what it is that you want to feed your dog. I want to feed my dog turkey, and I want to feed it green beans. I want to feed it carrots and broccoli. And if there is anything missing in there, then they will make that recommendation. But for the most part, meat and vegetables, and you probably don't need much beyond that. But if you want to be really complete, then the Balance It website will help you out.
All right. Sandra, thank you for calling. And let's go to Megan in Sauk City. Hi, Megan.
Hi, thank you for taking my call. I have a tabby male cat who this winter had started here and there showing like an itchy skin or something, where he will just randomly he'll be laying on me, but then he'll jump off and his back will start twitching, and he'll do like a rabbit paw thump, and then lick at his back end, around his tail and his back. And I got a video and I emailed it to my vet, but I hadn't heard back. And I heard your show was on, so I didn't know if you guys had any thoughts. I looked for fleas and I didn't see anything like any bugs or anything.
So Megan, how old is your cat, and is your cat inside all the time?
Yeah, my cat is 5, and he will take them outside, on a leash, when the weather's nicer.
Yeah, okay. Well, to look for fleas, to look for mites, we've already talked about Demodex today, which is not very likely, to be honest with you. Those would be the first steps. But you've just described word for word, note for note, a cat that's on the spectrum. And that spectrum in this case would be somewhere between hyper grooming, and hyper grooming are those cats that will obsessively lick themselves to the point that they will remove patches of hair on their body. But when you talk about a cat that will be laying there perfectly calmly and leap up from a nap, and it almost looks as if there are waves on the ocean in your cat's skin, and they will maniacally be chewing at their skin and licking at their skin, that is a condition called hyperesthesia. And that one's going to require some maintenance and some management. And as is the case with so many conditions, it has a tendency to present to us in varying degrees, from mild and moderate to really remarkable. And when your veterinarian gets back to you, they're going to have some recommendations ranging from gabapentin to fluoxetine to phenobarbital for that condition, but should be able to help the poor guy.
All right, Megan, there you go. Thank you. Penny in Altura, Minnesota, we turn to you. Hi, Penny.
Yeah, hi, Larry. So I have probably an 8 or 9 year old tabby cat. This cat, along with others, had been feral cats I cared for back on the East Coast. And when we moved here to Minnesota, I got everybody in the house before we moved for a while, so they could come with me and live a nice indoor life. So this one cat, he had a little bit of a runny nose back in New Jersey. Over time here, the one side of his nostril really just runs almost constantly. Occasionally the other side will flare up, and sometimes it'll even be bloody discharge. Occasionally it'll get a little cloudy, but mostly it's clear. I've had him to the vet many times. His teeth are fine. We've tried him with Convenia and a steroid, which seemed to help a little bit, but it did come back. It doesn't really seem to bother him. He eats. He's happy. He snuggles. He's a really good cat. But I just
wonder
it's
about
gross. He sneezes.
Yeah, this nasal discharge.
Yeah, well, what you've just described is, in highly scientific fashion, a cat we call a chronic schnorkeler. And Bill Stork did not make that term up. That term is from Dr. Lapin, Michael Lapin, out in Colorado, who has made his career out of studying cats with chronic upper respiratory situations. And there have been people, and we got to get to news here fairly soon. There have been people who have gone to the end of the earth and done every test under the sun, and still these cats will have this nasal discharge. It can be chronic, very difficult to cure.
Unfortunately. Penny, thank you very much for calling. Dr. Bill Stork, our guest, and we'll take a look at the news and then we'll be back. I'm Larry Mueller. Taking a look at your pet's health on the show today, Larry Mueller with my guest, Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic, works with both small and large animals. Great to have him back with us, and I hope you'll join in with your own questions. The number's 800-642-1234, or if you'd like, you can send an email to talk@wpr.org. Laura emailed us about male cat urinary blockage, and her understanding was that it's caused almost exclusively by cheap and poor quality store pet food.
Well, that could certainly be a contributor to it, but there's been lots of dogs over decades and beyond that have been raised on farm and fleet dog food, and lots of cats that have lived to be 15, 18 years of age on poor quality food. We've talked several times about these cases. There's a lot of factors that could contribute.
There are indeed. I think my own cat, Coco, is eating very, very well when he exhibited that problem. Jean in Ashland will give you a chance. Hi, Jean.
Hi, thank you very much for taking my call. I have a question regarding tick prevention, medications, oral medications. I have a corgi that's a small dog who I just adopted, and we don't have any history. Now, how do I know it's not going to cause a seizure? Because I keep reading and hearing about the things that these stronger oral medications can cause, and I want to prevent a seizure or some kind of reaction like that, and wondered how to proceed.
Man, I'm glad you asked that question. Does everybody in Ashland and Washburn have corgis? Because we had a caller previously from Washburn that was asking about ticks and corgis as well. Wonderful little dogs. So how can you know that the medications are going to be safe and they're not going to cause seizures? So on almost every flea and tick prevention on the market, there is a warning to the effect that this may be associated with neurologic activity and or seizures. Associated with is not to be mistaken for caused by. And when those studies get done, there are groups of dogs that are in the control group that do not get the medication, and there are dogs that are in the study group that do get the medication. And if there is one dog in 10,000 that has a seizure, then it has to be reported that this medication can be associated with dogs with seizures and neurologic events. Of note is that there were also dogs in the control group that didn't get the medication who also had seizures. So it's very highly unlikely that the medications are going to cause seizures. And here again, we're always weighing risks versus benefits. And you are in Tick Central there on the shores of Lake Superior, and there are ticks everywhere, and a fourth of them have Lyme disease. So the risk of Lyme disease is much greater than the risk of those medications causing seizures.
Gene, there you go. Thank you for calling. Patty in Madison, your turn. Hi, Patty.
Hi, thank you so much for taking my call today. I have a female tabby She is probably 14 years old, and she has been diagnosed with IBD or IBS. She has had this for many years, and she is on a completely raw diet, which seems to help her quite a bit. And she's been taking prednisolone and metronidazole when needed. And I'm wondering if there's anything else that could be done to help her. She seems to be very uncomfortable much of the time, even with or without the prednisone or with or without the raw diet. I'm wondering if there's anything else that could help for IBD or IBS for her.
Yeah, Larry, we seem to be specializing in corgis and tabbies today.
Yeah, we are.
I'm sensing a trend. But first of all, it sounds as if you have some excellent veterinary care with regard to the raw diet, the metronidazole, and the prednisone. And man, this is a wicked, mean, and nasty affliction. And to be honest with you, it sounds as if you've got your bases covered nicely, because the raw diet that you're feeding is going to be as lowly allergic as you can possibly feed. And, the metronidazole, sadly, we end up having to give that to these cats as needed. And the prednisone, man, we used to say in vet school, nobody gets out of this world without being on prednisone. And it sounds like the case in your cat.
And IBS, what is it? It's
well, inflammatory bowel disease is, so if we were to absolutely diagnose that, and maybe that took place with Patty's cat, is we go in surgically and we take biopsies at various spots along the intestine, and we send those out to a pathologist, and what the report comes back is in lymphocytic plasmacytic gastroenteritis, inflammatory bowel disease, and the bowel gets thickened and it doesn't absorb things as well as it is supposed to. So that's the long-winded answer.
Okay. Patty, thanks again. Perry in Oconto will turn to you now. Hi, Perry.
Yes. Can you talk about, I've seen some studies of retinal toxicity in some of the heartworm medications, ivermectin, and there was a couple other ones. And it was that maybe you could avoid that and use like an interceptor medication instead.
Yeah, that can be associated with breeds as well. Excuse me. And first of all, the ivermectin in heartworm prevention is at an incredibly low dose. I mean, it is nearly a microscopic dose of ivermectin in heartworm prevention. But especially in our shepherd breeds, we will have a tendency, or in the collie breeds, we'll have a tendency to use ivermectin or use interceptor just to be on the safe side. So those chances are really, really low, but there's a great option, which is interceptor, to be on the safe side.
All right. Perry, thank you for calling. You can join in too at 800-642-1234. Give a call. We'll get you on pretty quickly. Wendy emailed us. Wendy lives in a condo, and it's been so dry. She's let her dog out in the back common yard area, and there's large brown spots in the grass after the dog pees. Check with her vet about these supplements she sees advertised to neutralize urine, and there wasn't really any that he thought he could recommend. He said to just give the dog more water. Wendy doesn't think that's helpful. What's the best method for dealing with this?
Well, the first would be to get your dog to pee on the neighbor's yard, and then they have to worry about the crop circles. So the reason for that, and the reason why your veterinarian is recommending to give your dog more water, is because the reason why you see dead grass at the center of where the dog has urinated is because a very high concentration of nitrogen, and that leaches kind of like pebbles in a pond in concentric circles from the middle, and that grass around the dead grass will be really thick and lush. So the true solution to that is to go to the spot where your dog has urinated and dump a bucket of water on it.
Yeah,
and that will dilute the concentration of nitrogen and turn that from a brown spot to a healthy spot. But not everybody wants to follow their dog around with a bucket of water.
Jane in Oregon emailed us. A 5-year-old spayed female lab found a dime-sized, smooth, domed, gel-feeling mobile lesion on the left side of her sternum. Not tender, but if Jane checks it too long, the dog gets annoyed. Healthy, trim, athletic build with frequent exercise. Should Jane have this aspirated or biopsied? Can she follow it conservatively? What would be a worrisome change? No scrubbing or hair loss, no other lesions. If she were human, Jane would call it a lipoma.
And if it's a 5-year-old dog in Oregon, it's probably a lipoma as well. But over the years, we have found, and the safe response to this is have it checked out. It's likely a lipoma, but very, very infrequently, we will stick a needle in one of those lesions and make a slide out of it and find out that it's, a mast cell tumor or something that is more intimidating than that. You're probably safe, but to be 100% sure, it's worth having it checked out.
Michael in Madison's wondering if you can spell the part of the feline spectrum you referred to earlier. Hyper grooming to hyper what?
Hyperesthesia. And thankfully, I've got a pad in front of me so that I can write it as I spell it, Michael. Hyperesthesia is Aesthesia. Aesthesia. AESTH should get Google to take you where you need to be.
Okay. Lindsay from La Crosse email. Lindsay has a 5-year-old female Siamese mix who always has been pretty vocal. About 3 weeks ago, she put her golden retriever down, who has been her cat's companion for 2 years. Since then, her cat has seemed stressed, lonely, and been more vocal, especially at night. Do you have any recommendations to help with her stress and discourage her, quote-unquote, talking?
Yeah, well, a Siamese that talks, what will they think of next? Not unusual, but especially in a situation where she's lost her companion, the things that you can potentially do is to engage the cat to whatever extent the cat will be engaged. I mean, if that cat can be taught to play fetch and glitter balls and feathers and strings and any engagement exercise, enrichment and exercise that you can think of. Cats are hunters. Instead of just feeding their food in a bowl, take that food, divide it up and hide it in the closet behind the shoes, upstairs, down the basement. So they've got to go looking for their food or put food or treats in a treat ball. So they have to bat it around the house in order to spend both mental and physical energy. And another thing that once upon a time I used to place in the category of hocus pocus medicine is the feel-away diffusers, the pheromone diffusers. It's a little bit hard for us to scientifically explain the mechanism of these feel-away pheromone diffusers, but long story short, I've seen them help.
Question about grooming. How often should you brush your cat or your dog's fur?
There's a different answer to that question for every dog. If you are my dog Wrangler, who just came home from Texas and rolls in dead things at least once or twice a day, then that dog gets bathed and groomed about twice a day. You want to, one, brush them and groom them frequently enough so that they're used to be brushed and groomed. And if they object to it, if they want to move away, let them move away. If they accept it, then reward them for that and keep it within their threshold. So brush them, groom them as long as they're comfortable, as long as they're accepting it. And then once you have it as a part of their world that they're okay with, then, when they get mats, when they get tangled fur, when they get fur between their paws like the Grinch, then you can handily trim that fur, brush that fur.
Yeah, that's John was wondering if you got a longer-haired dog, it got matted. How do you deal with the matted?
Yeah, brush them more frequently. And if you have a Springer Spaniel and you have burdock, then you need this product called Show Sheen that you'll find at Farm and Fleet or Tractor Supply in the equine section. And it's a spray-on conditioner that helps you comb those things out of your dog's fur more easily.
That makes some sense. We haven't talked about trimming. I mean, thinking back to spring, things to do in spring, maybe it's trimming your pet's claws. What's the best way to do that?
The best way to do that is gradually, and everything that I just said about grooming and brushing, apply that to trimming your dog's toes. And if your dog objects to it, don't make it a wrestling match. Don't make it a knockdown, drag out, tackle them. Do touch training and look up a video on the internet, on YouTube, of touch training. So many people with the best of intentions will handle their dog's or their cat's paws to get them used to having their nails trimmed. Handling their paws gets them used to having their paws handled. Trimming the nails is a whole new level of noxious in their world. And I suspect that the sound and the sensation of having the nails trimmed is entirely different. So if they want to pull their paws away, condensed explanation here, let them pull their paws away. If they want to pull their paws away 18 times, let them pull their paws away. When they no longer pull their paws away, reward them for it. Trim the nail. And if they'll only let you trim 3 nails a day, then trim 3 nails a day, but don't push them too far.
I'm wondering about what's the best implement or whatever to use in trimming.
Oh, the ones in our exam rooms, they have orange handles. I don't know exactly what they're called, but the guillotine models we do not recommend, because the guillotine models take the blade and shove it up against a loop, and we're not as fond of those things. For cats, quite frankly, I like toenail trimmers better than any other type of trimmers that I've found, because cats have flat nails. Toenail trimmers are flat.
And allergies. You know, we've kind of hit on allergies. Pets have allergies like humans. What about dogs? What are typical allergies you see in dogs?
Dogs have allergies, and the short answer is get on it early. Do not let it get to the point that they have saliva-stained paws, that they're licking the fur off their paws, or they're opening up the skin on their paws or their flanks where they are licking. Start early. And so many people start by moving their food around, by changing the food that they offer their pets. Food can be a player, but usually it's only part of what is causing them to be allergic. To get a little bit of an insight as to what they're allergic to, we look at the dogs we actually do allergy testing on. And when we do allergy testing, we'll test them to 180 different things. And usually it comes back that they're allergic to 50 out of the 180 things that we test them for. And that's no kind of exaggeration. And most of the time it's airborne things, box elder, and anything that you can think of, ragweed. A thing that can oftentimes play into it are things like dust mites and grain mites. And here's a little trick that can save you in some cases. We've known dogs to be allergic to grain mites, and those exist. If you store your dog's food in a plastic container, like a Tupperware or something, that effect, that's great. But you'll notice that there's an oily film on the inside of that Tupperware, on the inside of that plastic. That is the perfect place to grow and culture grain mites. So we recommend that if you're going to store it in plastic, scrub it out, even replace that piece of Tupperware fairly frequently, or just keep it in the bag and get a plastic container that's large enough that you can put the bag inside the plastic container and then feed from the bag.
Makes a lot of sense to me. Dr. Bill, it's always a pleasure talking with you. Are you a busy guy now? I imagine your practice is always busy.
No, it used to be more seasonal than what it is, and now that's kind of spread out, and we're very fortunate to be occupied. We're very fortunate to be busy. We're grateful for that.
Yeah, I have, and you got to see one of my favorite dogs, Lila.
Yeah, I absolutely did. Lila's so sweet.
I love that dog, and I'm looking forward to spending 10 or 14 days with her when her mom goes away on a trip. So
yeah, fantastic.
Bill, thank you so much, and we'll look forward to your couple of months down the road. Thanks again.
You bet. We'll see you in a bit, Larry.
Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic. He's got a great, he does a great job on the show, and does a great job as a veterinarian as well, obviously. Well, coming up, we're going to take a look at the Wisconsin Humane Society and adopting a pet. I'm Larry Mealer for WPR News. Thanks so much for being with us here on WPR News. Larry Mealer here, turning our attention to the Wisconsin Humane Society now. You know, giving a shelter animal a warm bed, a place to call home, it can be a very rewarding experience. And today we're going to check in with the Wisconsin Humane Society to hear about their adoption processes and a whole lot more with our guest. Alison Fotsch is president and CEO of the Wisconsin Humane Society. And as we talk with Alison, I want to hear from you. Tell us about your pet that you adopted from the Humane Society. Maybe you can share what the adoption process was like for you, or maybe why you picked your pet out of all the rest. Give us a call. The number's 800-642-1234, 1-800-642-1234, or send an email to talk@wpr.org. Alison Fotsch, welcome. Thank you for taking time to be with us today.
Oh, thank you so much for having me. It's my pleasure.
I think most people certainly have heard of the Humane Society, but maybe they don't know all that you do. So maybe you could describe the work you do for the animals and people in Wisconsin.
Sure. So our mission is to make a difference for animals and the people who love them. And we have the honor of doing that across 6 counties in Wisconsin. We actually have 6 sheltering locations. Starting in the north, we have our Door County location located in Sturgeon Bay. We have a Green Bay campus in the city of Green Bay. Our Ozaki campus is located in Saukville, Wisconsin. Our Milwaukee campus is in Milwaukee, and it's effectively the headquarters for our organization. And then we have our Racine campus located in Mount Pleasant, and our Kenosha campus in the city of Kenosha as well. So while we're the Wisconsin Humane Society, not necessarily in charge of every shelter in the state, we're a private nonprofit organization with those 6 sheltering locations, as well as a high-volume spay-neuter clinic in West Dallas.
Yeah, so you got lots going on. How are you? You're a nonprofit. How are you funded?
We're funded primarily through contributions. So really the amazing gifts that our community sends our way in support of the work that we're doing make up the bulk of our funding. We also have some earned revenue. Obviously, we collect some adoption fees with the adoptions that we're doing. However, our investment in the animals to get them ready for adoption outweighs the revenue that we earn there. So in large part, aside from service fees, the vast majority of our funding comes through contributions.
You know, I took a look at your background and education and so forth, and it seemed pretty intentional about the kind of study you did. I just kind of wonder what drew you to this work in the beginning. It had to be a long time back.
Yeah, well, it was kind of unintentional, to be honest. I've obviously, like many people who end up in our field, clearly have a passion for animals. And as a child, I was always drawn to them and they to me. But I never really was focused on a career with animals because I didn't know all of the careers that were out there aside from becoming a veterinarian. And so I originally went to school for something very different, and then got involved as a volunteer in the rescue community. And upon returning to Wisconsin, after a bit of time out of state, got involved with the Wisconsin Humane Society. I was actually looking to volunteer as a dog walker. We can always use additional dog walkers. But they were hiring. They were hiring for an adoption counseling position. And so I threw my resume out there, and they've been stuck with me for almost 18 and a half years. So it was really through a variety of, fortunate timing and I do have a passion for this work and have had a lot of opportunities as our organization has grown, and for that I'm very grateful.
Maybe we could talk about why someone should think about adopting a pet instead of going a different route. I'm wondering if it's right for everyone.
Yeah, so we have just a tremendous number of animals in shelters, but also a variety of animals in shelters. If you look at our website today, we have cats and dogs. That's the primary animals that we serve on the adoption side. But we also have, today we have a chicken that's looking for a home. We have some guinea pigs. And so there's just a variety of animals out there. And, you are giving that animal a second chance in a lot of ways. But it is also, it's a great way to, find an animal that's a match for you. If you're not exactly sure what you're looking for, you can come in and work with one of our adoption counselors, either a staff member or volunteer in those roles, and they're going to guide you through the process and share with you the information that we do have about the animal, learn a little bit about what you're looking for, and work to create a great match for you. And if it's not a match that day, we get new animals all of the time, and so our website is updated in real time. As animals go home, their pictures come off of our website, and so it's a great way to see who's available for adoption as well.
Lewis in Green Bay has something for us. Let's go there. Hi, Lewis.
Hello, how are you?
Great, appreciate the call. What's on your mind?
Well, I just wanted to say I adopted about 4 years ago 2 sibling kittens. They were 7 months old, so I don't know if that's still kitten stage or not, but in the past I'd always adopted, frankly, mature animals because I just like their energy, and I frankly think that a lot of people bypass them. But at that point, the cats who were available were these 2 young siblings. And I had some initial concern about adopting 2 animals at once, and I didn't know if being siblings, if they would bond with, the humans in the household and whatnot. And I have to say it was the best decision I think I've ever made. They They remain very bonded, but they also bonded very quickly with the human household. They are extremely well socialized. I think that it allows you the peace of mind that if you're out for the day running errands and whatnot, you don't have the concern of a lonely animal. Not that I don't know if cats are really lonely or not, but they certainly they seem to be inseparable and just extremely well socialized. People who visit our home always comment on how well socialized these cats are, and I do think part of it was the transition from their previous living situation to a shelter to our home was made much easier by the comfort that they gave each other and the familiarity that they gave each other. And I really want to compliment the volunteers at the Wapaka Humane Society who really answered all of my questions and my concerns about adopting two younger animals at once.
Oh, Lewis, thanks for calling. Comments, Allison?
That's fantastic to hear. We definitely encourage kittens in particular. They tend to do better in pairs for a lot of the reasons that Lewis mentioned. They keep each other entertained. So if you are out of your home for a bit, they're going to have the comfort and security of one another. And when they get into those kitten antics, they can take it out on each other. And so it's just really encouraging to hear. And we, again, like I said, would recommend the same at WHS. We do, of course, place single kittens or single cats into homes all of the time, but kittens tend to do best in pairs, and so that's just really great to hear.
Yeah, Lewis, thank you so much. Do cats get lonely?
That's a great question. I think it depends on the cat. I've had cats in my life that, whether they were fosters or permanent residents, that were really excited when I was around, and others that were like, oh, great, my food bowl's empty. If you could do that, that'd be, if you could fill that for me, that'd be great, and go about your business. So I think it really depends on the cat, just like any individual animal.
And I'm wondering about age. Are older animals, older dogs, for example, are they sometimes more difficult to place?
Not necessarily in our experience. I think that there are people out there that are looking for, whether that's a specific age, or Lewis mentioned that he had adopted some older, more mature animals. Like that's just a better match from perhaps it's exercise or just energy or time commitment. And so we don't actually see senior animals taking longer to get adopted. Sometimes there's more considerations. We might have, more things that we're talking about in terms of health or some known behavior or something along those lines. But there are folks out there that love the seniors and exclusively adopt them. And there are others for whom they don't necessarily know they're in the market for a senior, and then they come in and fall in love. And so we're fortunate to say that there is not necessarily a huge disparity between, younger animals and older animals getting adopted.
In your experience, are there some misconceptions people might have about adopting an animal?
Well, I think, some of the misconceptions might be of our own doing over time. Our adoption experience has certainly evolved. Like I mentioned, I joined as an adoption counselor, and so I was doing those placements about 18 years ago. And how we approach the adoptions, I think there are some stigmas out there about, this approval or denial process. And at WHS, we really just want to have a conversation. And so we, of course, want to help our adopters make great decisions for themselves and their families, but we're there as a partner to really share information to set the stage for not only partnership in making this adoption, but for a relationship ongoing, because we know things can change or, you get the animal home and now you have a bunch of questions. We want you to be able to, give us a call or reach out. And so I think some of the misconceptions are, that shelters are sad places. And in fact, sure, we see some sad things on occasion, but we get to see so many amazing families coming in, whether they're donating their time as volunteers or foster parents or completing these adoptions, taking animals home. It really is a positive place. And from the actual adoption process, we're really there to support. We really strive to set the stage and culture environment that it's not judgy. We're not there to judge you. We're there to answer questions and share information to set everybody up for success.
Bruce in Madison emailed us. He's retired, 70-something, in good health, and thinking of adopting a dog. Bruce says he lives alone in Madison and hasn't had a dog since his kids were young in the 80s. He's thinking he should choose an adult dog, given his age, rather than a puppy, and would prefer a mid to large-sized dog. Any thoughts or recommendations for Bruce in Madison?
I think that's great to hear. I mean, animals can provide so much companionship, and it's really just about finding the right match for you and your lifestyle. And so taking a look at whether that's Dane County Humane Society out in the Madison area or any other shelters, or including our own, taking a look and seeing who's available for adoption and asking some questions just about the information that shelter might have about them. But there's so much research out there about the human-animal bond and how much animals provide to people. And so I think it's fantastic to consider, and certainly find a shelter rescue partner that can help guide the process.
What's the, in general, what's the range of adoption fees, and what do they usually cover?
So our adoption fees at the Wisconsin Humane Society range on the lower end at about $75 plus tax, to on the higher end, I believe it's at about $400 and I want to say $99 might be the very high end. And what's included in that is all of our dogs and cats are leaving spayed or neutered. They're also leaving microchipped. They are have a start on any sort of baseline vaccinations. We'll give all that information to the adopters so that they can continue to partner with a vet once they leave our care. They go home with, there's some corporate sponsor opportunities as well, whether that's insurance, pet insurance, et cetera. They're all going home with those options as well. And so, I'm trying to make sure I've covered all my bases. Spay and neuter, microchip, vaccines. That's the primary package. And of course, they've all been seen by a member of our veterinary team, as well as our behavior team as well.
And it's probably important to meet the animal you're thinking of adopting. Or is it?
Yeah, I mean, I certainly encourage you want to make sure that there's a connection there and you're comfortable with them. And so whether that's coming into the shelter, we have a number of foster homes that complete adoptions from their homes as well. But setting up that time to come in and meet and interact, sometimes you might be coming in for one animal. This has certainly happened to me over the years where I'm like, yes, this is who I'm adopting. And I meet with them. And it's not exactly the connection I'm looking for, and but the animal next door or the next week was a better fit. And so making sure you meet the animal and carving out some time to do so is a great first step.
Our guest today, Alison Fotsch, who is president and CEO of the Wisconsin Humane Society. Questions for her or an experience to share? I hope you'll join in. Number to call, 800-642-1234. Or you could email us to talk@wpr.org. I'm Larry Mealer for WPR News. Talking today with Alison Fotsch, who is president and CEO of the Wisconsin Humane Society. Give us a call with your questions or experiences. Again, the number's 800-642-1234. Email to talk@wpr.org. John wants to know what happens if you adopt a dog and then decide it's not the best fit. What's the best thing to do in that situation for you and for the animal?
Sure. That happens. And so if it's not a great fit, once the adoption has been completed, that's okay. Giving the shelter a call back. And, we have a free behavior tip line that's available to not only our adopters, but members of the community. There might be opportunities for us to either partner with you to troubleshoot what's happening, or if it's truly not a match, bringing the animal back to the shelter is not worst case scenario. It's an opportunity for us to learn more about that animal and their experience in a home environment, and it allows us to learn how we can better support you down the line. And so we don't look at those, whether you call them returns or however you want to classify them, those animals coming back to the shelter, those are positives, those are opportunities to both support the person and the animal going forward.
Yeah, makes good sense. You've got a foster program. Would you tell us more about it?
Yes, absolutely. So our foster program is an essential part of our shelter operating system. We have over 1,000 foster parents who open up their homes on a regular basis for thousands of animals in our care. And we simply couldn't do this work without our foster network. But animals need foster for a variety of reasons. So whether it's, a tiny little kitten, we're on the cusp of kitten season in Wisconsin. So a tiny little kitten that just needs space to grow big and strong, or even maybe it's a neonatal kitten who needs round-the-clock feeding. Those animals just need time, and that time is best spent in a home environment where they can get more one-on-one attention than even with the incredible team that we have in the shelter, where we are always outnumbered. So we've got really young animals. We've got, animals that have undergone medical, intervention, whether that's a surgery, amputation, et cetera. They need some recovery time. And again, that recovery is going to be less stressful and probably an easier recovery if they're spending time in a foster home. But also, sometimes animals just need to get out of the shelter. They need a bit of a break. And so we have a choose your own adventure opportunity where our foster parents, once you become a foster for us, which is a pretty easy process, you can select one of the animals that's looking for an adventure, and that could be a sleepover. That could be a field trip out of the shelter for a few hours. That could be a couple days, a week, however long it works for you. It's a great opportunity, especially for our dogs, to get out of the shelter and get a break. And there's research that supports that the stress that they're experiencing in the shelter immediately starts to diminish once they leave the shelter. And when they return to the shelter, that stress is not any higher than it was originally, but they do get that time away. And we get pictures all the time from our foster network of just dogs snoozing on couches. That's what they needed. They're decompressing. And those are the best pictures. I love getting those updates.
Are those benchwarmer tryouts? You've got something called benchwarmer tryouts program.
Yeah, Yes, we just launched that about a month ago. So our bench warmers are animals, dogs that have been with us long and looking for homes longer than average. And so we lovingly dub them our bench warmers in an effort to get them back in the game, so to speak. We've reduced their adoption fee. And just about last month, we launched Benchwarmer Tryouts. And it's a way for, again, we ask that folks that are interested in pursuing this option become foster parents first. But any of our foster parents can take one of those Benchwarmers home for a tryout. And that's basically a 7-day trial period for adoption. And if at the end of that 7 days, the family wants to adopt, that is fantastic. We can process that adoption without the animal returning to the shelter. And if it doesn't work out or there's a better match out there for you, great. That animal can come back to the shelter and we'll continue to look for a home for that animal. But those Benchwarmer tryouts are basically a foster to adopt option, specifically designed for some of our longer stay animals.
I love that idea. I love that approach. I bet in your position, you probably have a good idea of animal welfare in the state of Wisconsin. What can you tell us about the status of animal welfare in our state?
Sure. I connect pretty regularly with other shelter leaders, both interstate and around the country, just returning from a large conference just last week. And so, right now there's there's a crisis in animal welfare. And it's primarily because of the systemic issues that people are facing in our community. So there's issue facing people and pets because there's a shortage of pet-inclusive housing. So finding a home or a rental space that allows you to have a dog or a cat, and if they do allow you to have a dog, how big can it be? What breed can it be? Etc. It's difficult to find that, let alone it can also be quite expensive. There's also a veterinary shortage facing not only our industry, but also private practice. And so that just makes it difficult for folks to access care, and then can make it pretty cost prohibitive, even if they can be seen by their veterinarian or a veterinarian. And then there's just rising costs, which obviously impacts us too. Rising costs of goods and services for animals, cost of food, all of that is going up as, costs in general are going up. And so these systemic challenges kind of force people's hands, and therefore they're in a position where sometimes they're choosing between providing food for their animal or paying, a utility bill, and or making trade-offs for themselves. They'll feed their dog over feeding themselves. And so we are seeing those systemic issues impacting our organization, because we're seeing families separate from their animals, and it's heartbreaking to see. And yet the decisions that these folks are having to make are impossible decisions, and they are made and rooted in a deep care and love for those animals.
Yeah, that's got to be hard to deal with many times, I'm sure. What are some programs out there that might help families keep their pets? I know you even have some programs in the Wisconsin Humane Society, if I'm not mistaken.
We absolutely do, and this is an area of our work that I am and our organization is very excited to continue to expand. But right now we have pet food pantries at all of our sheltering locations. So if somebody needs a bag of food or some cans of food, we have those available. That is community-driven supplied, so it is food that's donated to us and that we pass on to the community. So it's not a super consistent option. And I can tell you at our Milwaukee campus, our shelves are often more bare than they are stocked, but that is an option available, is a food pantry options. We also offer low-cost vaccine clinics at all of our locations, including at our spay-neuter clinic. And that's just an option to come in and get some of the baseline vaccines covered at a lower cost. And last year we served 8,400 animals through those clinics, which is just pretty incredible. I think we had about 36 of those clinics organizationally. So really trying to make sure animals are staying healthy and in their homes. And then I think I mentioned earlier, we have a behavior tip line that's accessible to our community, but we also offer training classes. And so you can find all of that information, register for those classes on our website as well.
And maybe talk a bit about the volunteer opportunities with the Humane Society. I mean, you started as a volunteer.
Yeah, so we could not do this work. I mentioned foster homes. We can't do this work we certainly could not do this work without our volunteers. So there's a number of ways to get involved, whether you're looking to volunteer within a shelter, whether that's dog walking, or we have volunteers who are supporting our kennel staff by providing animal care support. Laundry support. You can't imagine how much laundry we generate in the shelter, but having someone there to turn over the loads was really important. But we also have ways to get involved. Like I said, if you can't commit to the in-shelter volunteering, foster may be an option for you. But we have things like event volunteers who support at some of our community events throughout the year. So there's just so many different ways to get involved. And again, you can start that journey from our website as well.
And your website is?
wihumane.org.
Yeah, it's an easy one, wihumane.org. Allison, you're doing some wonderful work. I want to thank you so much for taking time to be with us today. My daughter, Diane Mealer, has done a lot of work, and I think may know you. I'm not positive.
I think so.
But thank you so much, and I hopefully we'll have a chance to do this again.
Yeah, that would be great. Thank you so much.
Alison Fotsch is president and CEO of the Wisconsin Humane Society. Thanks to her, and thanks to you for joining in today. Tomorrow we'll talk aquaponics, and we'll also take a look at kayaking and canoeing. Thanks to our team, Clara Neipert and Joel Patnaud, our producers, our technical directors, Lee Rayburn and Jeff Robbins, our executive producer, Jill Nadeau. I'm Larry Mealer, and hey, stay with us. Lots more in store here on WPR News.